Hi there, my name's Jeremy Lewis. I was born in New Zealand. I grew up in New Zealand. When I was a teenager, I moved to Australia, and that's where I decided I wanted to study physiotherapy. And about 23 years ago, went to live in London. The plan was to live there for a year, but we've been there ever since. But still maintain quite strong connections with Israel. I had a professorship at Haifa University for a while. I've got a couple of professorships at different universities around the world. And I also work as a consultant physiotherapist in the National Health Service in England. My boss very kindly allowed me 3 weeks to come and volunteer in Israel, volunteering mainly at Tel Shomer, but also in Kibbutz En Gedi with people who were from Kibbutz Be'eri, Kfar Aza, Sderot. And I've also been down to the border, working with a group of physiotherapists, treating soldiers coming in and out of Aza, as another part of the volunteer work that I've done. But my main volunteer work has been at Tel Shomer. It's been a very difficult experience for me. I'm not a person who cries a lot, but on the bus on the way home for the first few nights, I was surprised to find I had tears in my eyes, seeing patterns of injuries that I'm not that familiar with. I don't think many people are familiar with. I certainly have treated a lot of very serious trauma during my career, but not the sorts of problems I've seen. So it's very difficult to see a lot of young people with such severe injuries, but amazed, inspired to see how much positivity there was from the soldiers during their rehabilitation. I think that in a large part is due to the physiotherapy staff as well, who are an amazing team of physiotherapists here, who are working again, I guess, all learning this new way of doing rehabilitation, which none of us are accustomed to. Everyone's been inspirational in the sense of the severe level of trauma they've had to face and they are facing and coming to terms with. And I really hope when I can, I'll get a chance to come back and do some more volunteer work and hopefully get a chance to catch up with those inspirational patients who I've been watching. I've been having tears in my eyes at how hard they're working, and their parents are having tears in their eyes at how much their child has suffered and how far the journey they have to go on. So the best thing for me has been the people. The best thing, in all honesty, the best thing has been the physiotherapy team that I think are working in exceptionally difficult circumstances, who are dedicated beyond most physiotherapists I have seen in my career. And yeah.